Hello, it's Abby Palmer, physical therapist at Promotion Physical Therapy in Rapid City, and today I'm just going to walk you through some exercises that you can do before you have a low back surgery, also known as a lumbar surgery. So the first exercise that I want to show you is a lumbar rotation. So for this, you're going to be laying down with your knees bent, and you're just going to be letting your knees fall back and forth from side to side. The next exercise, I want you to tighten up that core muscle, and the way that you do that is by just pulling your belly button a little bit in towards the mat and up towards your face. And you should be able to, if you bring your fingers just in from your pelvic bone, you should be able to feel that muscle turn on there. So with this one, your legs are going to be out straight. I want you to turn on that muscle, and you're going to just lift your leg off the table. And next, there are just a couple stretches. The first one is going to be a hamstring stretch. For this, I will use my strap, but at home you could just use a belt with a loop at the end. If you have a sheet or a towel, you can kind of be creative with this. But you put the loop over your foot, lay back, relax, and you can stretch up that leg. And for this, you'll want to hold it about 30 seconds to a minute on each leg. So the next stretch is going to be a piriformis stretch. So for this stretch, you're going to cross one ankle onto the opposite leg, and you're going to grab behind that knee. You're going to pull up until you feel a stretch. Should be kind of deep in the buttocks of the leg that's crossed over. And again, you're going to hold this for about 30 seconds to a minute. So the next activity that you'll want to work on is what we call a pelvic tilt. So if you picture your pelvis is a glass of water, we want to work on tipping that glass of water forward, and then tipping that glass of water back, and kind of moving it through that range. So if you picture your pelvis is right here, we're going to tip it forward and we're going to tip it back. I'll show you that from the side as well. So we'll tip it forward, kind of arch that back, and then we'll tip it back by tucking that pelvis underneath, forward and back. And we'll work on this laying down. So in this position, you can tip it forward, kind of lift that low back off the mat, and then tip it back. Press that low back into the mat. Forward and back. And this can be just done in whatever range is comfortable. So if you don't feel like you can move very much, just move in a smaller range. And it should just be a comfortable speed back and forth. Okay. The next one that I want to work on, you'll be sitting here, and I want you to trace your hands down forward and stretch that low back. Let that low back stretch out and come back up. And bend forward, stretch out that low back, and back up. Lastly, I want to work on what we call a wall crawl. So with this, you'll take your arms, trace them up the wall, let that stretch out a bit, and come back down. After your low back surgery, your physical therapist will really be working with you on a lot of things. So they'll be helping decrease your pain. They'll be helping to stretch out any muscles that are tight. They will help you strengthen all the muscles in your core and your hips that are supporting your spine and your low back. And they'll help you get back to your functional activities. So they'll help you be able to get out, in and out of bed without pain. They'll help you with lifting, carrying, going up and down the stairs, anything during your day that you really have to work on that you might be having any pain or difficulty with. If you have any questions or concerns, or if you'd like to get scheduled for that physical therapy before or after your surgery, go ahead and give us a call at Promotion Physical Therapy, 399-9565.